The obvious biggest difference perhaps between patients and others is that for value for patients to a variable extent includes how much they have to pay for the intervention. I mean, clinically they may see value in having a wide variety of choice. They may they may see a lot of value in their relationship with doctors and the ability to have the care tailored for them. Payers are responsible for populations as well as for the care of individual patients. So when they think about value, they think about what interventions are available now, therefore, what is the clinical kind of marginal or incremental benefit that this new intervention could bring, both again to the individual patient but across a system of care. And that's where the cost situation comes in as well. They have to think about their mandate to be a good steward of costs requires them to look at costs across the total healthcare system. So that is, I think, one of the key reasons that the perspective on value and even how you measure it and talk about it can be so different. There are so many different ways to evaluate it. You can talk about all the different components. We want to talk about the clinical value, the clinical benefits. We can talk about whether there are existing treatments already or not. That has a big role in deciding how much clinical value a new treatment might bring. And you can talk about cost, but how do you actually integrate all of those in some kind of overall judgment? And that's where there are really different approaches. You can look at what's called cost effectiveness, which is a kind of incremental cost per some incremental clinical benefit. Or you can talk about how much the budget will be impacted by adopting a new intervention. Those two ideas, cost effectiveness and what many people call affordability, reside uneasily together in the way that most people think about value and talk about it. So we're going to be trying to do the best we can to create, again, a conceptual framework that will allow manufacturers, payers, and other stakeholders to really understand how cost effectiveness, affordability, and other aspects of value fit together.